Bird flu or avian influenza is a virus that primarily affects birds. It can infect domestic poultry like chickens, turkeys, and ducks. Wild birds can also carry and transmit the virus. Bird flu viruses have different subtypes. Some subtypes are more dangerous than others. Highly pathogenic avian influenza or HPAI viruses are particularly deadly. They can cause severe illness and death in birds. Bird flu viruses can sometimes infect mammals, including humans. This usually happens through close contact with infected birds or their droppings. Symptoms of bird flu in humans can range from mild respiratory illness to severe pneumonia. In rare cases, it can be fatal. Bird flu viruses are constantly evolving. They can mutate and acquire new characteristics. This makes them unpredictable and challenging to control. The emergence of new strains with pandemic potential is a significant concern for global health security. The current global outbreak of bird flu, particularly the H5N1 strain, poses a serious threat to animal and human health. Understanding the virus, its transmission, and its potential impact is crucial for effective prevention and control measures. The world is witnessing an alarming surge in bird flu cases. The virus has spread rapidly across continents, affecting both domestic poultry and wild bird populations. The World Health Organization, or WHO, has reported a significant increase in outbreaks in recent months. The current outbreak is characterized by its wide geographical reach and the high number of bird deaths. Millions of birds have been culled worldwide in an effort to contain the virus. The economic impact on the poultry industry has been substantial. The virus's ability to spread rapidly through bird populations is a major concern. Migratory birds play a role in transmitting the virus across long distances. This makes it challenging to track and control outbreaks effectively. The surge in bird flu cases highlights the need for enhanced surveillance, biosecurity measures, and international collaboration to mitigate the risks posed by this evolving virus. Among the various subtypes of bird flu, the H5N1 strain has emerged as a particular concern. This highly pathogenic strain has been circulating in bird populations for several years, causing significant outbreaks in different parts of the world. H5N1 is highly contagious among birds and can cause severe illness and death, particularly in poultry. The virus has also been found to infect mammals, including humans, posing a potential pandemic threat. The H5N1 virus has shown an ability to mutate and evolve, raising concerns about its potential to become more transmissible among humans. Scientists are closely monitoring the virus's genetic makeup for any changes that could increase its pandemic risk. The emergence and spread of the H5N1 strain underscore the need for ongoing surveillance, research, and preparedness measures to address the evolving threat posed by bird flu viruses. The United States is among the countries grappling with significant bird flu outbreaks. The virus has been detected in wild birds and poultry flocks across multiple states, prompting concerns about its potential impact on human health and the agricultural industry. The U.S. Department of Agriculture, or USDA, has reported cases of HPAI in both commercial and backyard poultry operations. The virus has led to the culling of millions of birds, resulting in economic losses for farmers and potential disruptions to the poultry supply chain. The Centers for Disease Control and Prevention, or CDC, is closely monitoring the situation and working with state health departments to investigate any potential human cases of bird flu. While the risk to the general public remains low, the CDC emphasizes the importance of preventive measures, particularly for those in close contact with poultry. Section 5. International Impact. Bird Flu Beyond Borders. The bird flu outbreak is not confined to the United States. It is in fact a global concern affecting countries across different continents. The World Organization for Animal Health, or WOA, has reported outbreaks in Asia, Europe, Africa, and South America. The widespread nature of the outbreak really highlights the interconnectedness of animal and human health. The movement of birds, both wild and domestic, can contribute to the spread of the virus across borders. International cooperation is crucial for effective surveillance, information sharing, and control measures. The WHO, and the Food and Agriculture Organization of the United Nations, or FAO, are working together to coordinate global efforts to address the bird flu threat. So, let's take a moment to really understand the risks involved here. Bird flu, or avian influenza, primarily affects birds, but certain strains have the potential to infect humans. It's important to note that the virus can spread through direct contact with infected birds, their droppings, or even contaminated surfaces. The risk to humans is generally low, but it can increase if the virus mutates, making human-to-human transmission possible. This is why ongoing surveillance and research are absolutely crucial. Now, we need to talk about the looming threat. The possibility of a bird flu pandemic is a real concern. If the virus were to mutate in a way that allows easy transmission between humans, the consequences could be devastating. We must remain vigilant, as the impact on public health and the global economy could be profound. The potential for widespread illness, overwhelmed healthcare systems, and significant economic disruption cannot be ignored. So what can be done to curb the spread of bird flu? First and foremost, biosecurity measures on farms are essential. This includes controlling access to poultry farms, ensuring proper hygiene practices, and monitoring the health of birds regularly. Additionally, public awareness campaigns can educate people about how to minimize their risk, such as avoiding contact with wild birds and reporting any sick or dead birds to authorities. Vaccination of poultry can also play a role in preventing outbreaks. Finally, a call for global action is needed. Combating bird flu requires cooperation and coordination at an international level. Governments, health organizations, and the agricultural sector must work together to share information, resources, and strategies. It's a collective effort to develop effective vaccines, improve early detection systems, and implement rapid response plans. By working together, we can mitigate the risks and protect both human and animal health.